The NHS is the largest healthcare provider in Europe, but it doesn't have a lot of doctors compared to other countries. In OECD countries, the UK pretty much at the bottom above just France and Canada, Austria at the top there. Now, that has been the case for a long time. Going back to the 1960s, in fact, you can see it has been below that OECD average. And today in the NHS, there are 112,000 vacancies, a figure that has fluctuated but is pretty much the same as it was 5 years ago. And that's bad enough, but the workforce plan warns that without action, there could be as many as 360,000 vacancies by 2037. So not enough staff at a time when the ageing population is going to expand dramatically. Now, this is the plan to fix all of that. 60,000 more doctors, 170,000 more nurses, and 71,000 other allied health professionals in the period. The NHS also wants to retain more staff, 130,000 over the same timeframe. Now, add all of that together, and it is 431,000 more medical workers by 2036, an increase of around a third compared to today, so a big jump. Now, where does that leave the NHS in that league table? Well, this is the same table. We've taken out some of the countries to compare it. Look at what it does for doctors. We go from the dark blue here, that's where we are today, up to the red, a big jump up that league table. But for nurses, it is barely a rise at all. Those are pretty much the same, even after this workforce plan. Now, crucially, much of the increase is based on new training places and schemes. It's part of a plan to reduce the reliance on medical staff trained overseas. The aim is to halve the proportion from around a quarter today to around 10%. That's because the current plan leaves the NHS exposed to high labour costs and risks the sustainability of services given the growing global demand for skilled healthcare staff. Now, all of that, though, requires cash. And over the next 5 years, there'll be an extra £480 million each year. Now, that is certainly welcome. It represents around 0.3% increase in the total NHS budget. But it is also less than the NHS lost in real terms funding this April when the government chose not to uprate its budget according to inflation.